health care?
My answer would be until we do preventative health care, no.
I think health care is limited by the ability to pay.
Right.
And that's what it is now. Wealthy people can have anything they want. If you're poor, you're very lucky to get a Band-Aid.
That's not true.
Well, it is
because
in a lot of places.
There's many cases, and I'll go back to premature babies. There's many cases where the babies that are born premature, they have no money, and yet we're paying the millions. My daughter had a baby who basically was born without a brain stem. He was basically dead when he was born, but the parents would not give permission to take him off life support. For 4 months, this baby was in the neonatal intensive care unit at KU. How many millions of dollars did we pay because the parent had the right to make that decision to a baby that could not live?
I'm thinking in terms, just a second. I'm thinking in terms of like kids who can't have inoculations because they don't have clinics and this kind of thing to pay.
Okay, but I'm thinking, I mean, we can have a lot of kids that get a lot of inoculations for one baby who's for 4 months.
I see what you mean.
That's what I'm saying. We could inoculate every kid in Wichita for what this baby spent at KU.
What's your question? Well, my question is in regards to your idea about increase of supply of physicians. I mean, that is important, number one. What can we do in terms of, preventive care? How much can the state, invest in terms of investing in preventive care? Because I always hear when I was little, my mom used to say, prevention is better than cure. The doctors started real early. What can we do on the state level, to focus on preventive care?
Well, let's talk about some very practical things. One of the things I wanted to share with you folks is these proposals are entirely the opposite of saying, let's have the taxpayer pick up the tab. They're letting the free market system basically work. We have faith in that. We know that it can work. If we have the choices, if we know what the costs are, we can make some of these decisions we're talking about. Right now, we're leaving it to insurance companies. They're making those decisions without our consent, without the doctor's consent, and they have nothing to do with profit motive. We've got to take this back and think of us. You're talking about preventive care. What the state can do, and it has a lot of control over kids, for example, in schools, K-12 budgets, putting PE back into the schools, putting a balanced lunch on their table every lunchtime, making sure the snack machine's filled with fruit, and juices that people can actually digest and use as nutritious, and not Cokes and sodas, and things that make them fat, make them diabetic, all those things that we know are wrong for you. We're allowing corporations to come in, make money off of our kids, out of our parents' pockets, right?
I have to tell you, some principals do control that.
They make that decision?
I guarantee you, when I was a middle school principal, we didn't sell crap at lunchtime.
And we can do that statewide. We can do it statewide if we just take control. And we say, enough. Enough of this. We've got to take control for ourselves. Go ahead.
But for the increase of supply of physicians, what can we do in terms of actually recruiting more physicians, in, say, for instance, poor neighborhoods or in rural areas? What can we do in terms of on the state level to attract?
Isn't that nice? That's a great question, because if you have more supply, now you have more competition.
Exactly.
You have more incentive to go to the rural areas, to the urban areas, to the areas where folks actually get sick, just like the wealthy do.
Exactly.
But they need the service, and they need it now. If you've got, out of those 3,000 applicants, there are a lot of very good students in there. They were caring people. They wanted to serve. We didn't have any opening for them.
Or they wanted to make a lot of money.
Well, that's
Almost
true.
every pre-med student I met in my college talked about how they wanted to make $100,000 the first year.
Sure.
They had to probably pay back to
pay out their loan. But the
Well,
reality
that's
is,
one thing we could be doing, when you're talking about KU Medical Center and doubling the number of physicians going through there. We could do a more aggressive program of forgiving debt for doctors that go to rural areas and practice for 2 or 3 years.
well, the programs I've seen in Iowa, for example, we have a program there for 5 years. You offset some of your expenses. And you have it when we had the Sputnik program. Remember that program back there in the 60s? A bunch of us, the science teachers, were allowed to offset some of our expenses as our student loans. if we went and taught science. Well, we have those incentives. We use the public coffers to try to encourage people to do the right thing. But I think obviously if you have more supply, you have more opportunity to say, all right, now where am I going to have black shingle? Where am I going to set up practice? And that'll help take care of this problem that you're talking about, getting physicians out where the people are. Right now, the incentive is to become tertiary care provider. Be a specialist, you make 3 times more money, you get referrals, and that automatically tells you you can add 3 zeros to the check. And what we don't have is transparency. We've got to start taking control of our own health care.
Okay, I want to wrap this